restoration!
Full pay restoration!
No capitulation!
Full pay restoration!
What do we want?
Fair pay!
When do we want it?
Now!
What do we want?
Fair pay!
When do we want it?
Now!
So my name is Mike Greenhalgh, I'm 34, I'm a junior doctor in trauma and orthopaedic surgery and I work at Withenshaw Hospital in South Manchester. So the reason that junior doctors have been forced to go back out on strike is because over the past 15 years we've seen our wages cut by over a quarter in real terms. Now, after a period of negotiating with the government, they're yet to bring a credible offer that we can put to our members to end these strikes, and they're just not listening to us. So unfortunately we feel like they've had no choice but to come back out on strike.
And to those who might not be aware, why is it important that junior doctors are paid more within the NHS?
So we've been seeing over the past multiple years that junior doctors are leaving the profession entirely, or they're leaving to other countries such as Australia, New Zealand, Canada, or even closer to home, the Republic of Ireland, where they are paid much better and they work in better conditions and are able to deliver the care that they've been trained to deliver. In fact, the South Australian Health Minister actually was on BBC News a few months ago actively recruiting junior doctors. Picket lines such as the one behind me, we've had the South Australian government coming with billboards trying to advertise and actively recruit doctors from the picket lines. So unfortunately, junior doctors are being driven out of the NHS and being driven into other countries' healthcare systems.
So I've often heard the name junior doctors as a bit of a misnomer. Could you explain what a junior doctor is?
So a junior doctor is anyone from day one post-qualification up until they become either a GP, a consultant or a senior specialist doctor. Now, that could be someone who's been working for 10 years, who's performing literal brain surgery. I qualified in 2016, I'm a junior doctor still, is my sort of how you would group me. And I've got at least another 3 years to go before I would be eligible to be a consultant, so that's over 10 years. So these are highly trained, highly experienced, highly qualified individuals, and so that junior name is a bit of a misnomer.
So the government agreed a 9% pay award last year, and they're talking about a continuous 3% pay rise. I'm aware the BMA has asked for 35%. Could you explain why 35% is an important percentage?
So as I mentioned before, junior doctors have lost over a quarter of their pay in real terms, and the amount required to restore that pay would be 35%. Now, no one's saying that has to happen overnight, but what we do need is to have a credible pay offer from the government that starts making its inroads into reversing those pay cuts. Now, the absolute minimum for that has got to be something over inflation that starts making progress to retrieving the pay that has been eroded and taken from doctors. Because as we mentioned before, if you continue to cut doctors' pay year after year after year, we're going to see more and more leaving the NHS, going to other countries, other sectors, and the knock-on effect of that is going to be there's less GPs, so people can't get appointments. It's difficult now, but getting even worse to get an appointment for people. 4-hour waits in A&Es used to be absolutely awful and used to be, when it happened it made the news. Now 12-hour waits are the norm, unfortunately. Operations where people have been waiting months and months and months for their operation and having to wait even longer to see consultants in the first place.
Now,
all of these problems need more doctors.
Sorry to interrupt, but for the person who sat at home who had an appointment registered this week and they've not been able to go to it, you're an orthopaedic, you work in orthopaedics, you've got people who will be coming in for hip replacements. What would you say to that person who at home might agree with you in principle, but in all reality they have missed a hip appointment and they don't know when they're going to get one?
So of course I'm very sorry for anyone who has had an appointment or an operation rescheduled due to the industrial action we've been forced to take by the government. But I'm sure the people who are sat at home will tell you that they waited an unacceptable amount of time for the operation in the first place, and the reason for that is because we don't have enough staff, and to get more staff you need a fair pay deal to keep the ones that you've got. Now, when I'm seeing patients in the clinic, we're unfortunately having to tell people who need a hip or a knee replacement, who are in pain, that at the minute it's going to take at minimum a year to get to them, and possibly even longer. Now, that's not acceptable, and this is the situation that we've got to after a decade of chronic underfunding and understaffing of the NHS. We need to start addressing those problems, and part of the way we do that is a fair pay deal for doctors.